Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of the series in around a series or the edition in around the cortical capacitor. This audio podcast as part of a MaxxaR pathology. This audio podcast as part of a Storm Robotics production. In this audio podcast, as part of works looking at electronic patient records EPRs and library services and multidisciplinary team meetings or MDT meetings, and where this works looks to answer or where the published works, and hopefully this audio podcast series looks to answer the question: Is it not time to integrate primary care for the better? So, in around this audio podcast, looking at health literacy, in around the importance around health literacy. So, whilst the internet and social media usage has grown exponentially, not surprisingly, people are identifying new sort of modes or modalities of collecting information and for the tech sort of savvy sort of individuals. The internet and social media offers advantages over standard forms of interact of information around information collecting, into interact in into sort of into sort of into connectivity, and also around a sort of around gaining sort of sources of information. The overwhelming basis of social media into lives necessitates a renewed commitment to changing the way society addresses the use of accessing context relating to advice, awareness, and knowledge around diseases and subject areas. The use of the internet and social media use does not suit everyone. However, in contrast to amongst those with, for example, some long-standing conditions, disabilities versus others, and also where, for example, where first language for example, may not be the English spoken language. For example, approaching methodologies or modalities to support health literacy is and will be is or has been a sort of challenging to an extent. To Has been sort of challenging to an extent, and so uh, and so and so the and so health literacy is at the same time has been evidenced as predominantly a skills based construct that does not include sort of the motivational elements, using modalities in around to improve health literacy alone to determine the needs of patients, and simplifying instructions, for example, as a result, maybe a barrier or hindrance to individuals, thus affecting sort of the sort of patient and healthcare professional the patient and healthcare professional collaborative effort, or the relationship between the relationship around the around patient care, and where patients sought to gain information from professionals, from healthcare professionals. And so as such, the patient may gain some of the understanding, however, does not have a sort of a mindset, may not have the mindset to take action. Well, works by one author in around 2014, at the same time highlight that what can be learned from patients living with, for example, chronic musculoskeletal conditions, healthcare professionals and carers about the concept around health literacy using a particular sort of a particular line of research. The team informed that patients sort of desire practical interactions, and search for more than knowledge, empowerment, and responsibility from interaction with and around in and around healthcare. At the same time, several investigations have shown or demonstrated that concerns that shared around decision making, healthcare decision making, is only of intrigue to can be of intrigue to only those who are sort of for example, middle class and middle class and where at the same time where it is not possible to interact with patients from all walks of life and educational backgrounds, if they are provided however, if they are provided with well designed information materials and given appropriate decision support by well trained by appropriate members of the healthcare professional workforce, then the authors in published works, also in around 2014, have highlighted that can make a little bit can make a bit of a difference. Importantly, more evidence has shed light that people with low health literacy tend to defer to health professionals to make decisions for them, and also tend to have less positive health outcomes than people who are more actively involved in around healthcare. The temptation for healthcare professionals are faced with someone who has little knowledge of healthcare matters, and is not confident about asserting views. Asserting views is to make is where as where there is a that there is a basis where decisions are made. The preferences for decisions to be made for them, thus further reinforcing passive role and their passive role and the tendency towards poorer health in the longer term. All should be encouraged and supported to become active partners in around healthcare, and library and health service partnerships should actively collaborate to ensure that there is a sort of broader health literacy available, health literacy sort of services or works available for those, for example, whose first language is not in English, for example, and in addition, information needs to be accessible for those with for example, disabilities, in around disabilities and sort of long-standing conditions. That draws this audio podcast to a close. This has been an audio podcast as part of a Cortical Capacitor. This audio podcast has been part of a MaxxaR Pathology. This audio podcast has been part of a Storm Robotics production.